Welcome to this Sleep Health podcast with Restonic Power of Sleep. I'm Dr. Alison Bentley from the Sleep Health Center, and today we're going to be talking about wearables. Fitbits, Garmins, Oura Rings, all of those that many people have that now all record sleep and sleep stages and give you things like body battery and oxygen saturation and all of these things that you can measure during your sleep. And often I will get patients coming in to see me and they will talk about their sleep problem, insomnia often, and blah, blah, blah. And here's what this, and then they'll say, and I have this watch and I don't know how accurate it is and I don't know what any of it means, but this is what it says. Okay. So what I thought we'd do in this podcast is walk through the wearables. So whether it's a Huawei, Samsung, iWatch, Garmin, Fitbit, all the kind of watches, and then the Oura Ring just being slightly different where it's measuring. Walk through that and just go through the outputs that we get from that, how accurate they really are, how we should use that information, and also look at when is it telling you that there is an actual problem. So what is normal, what is an actual problem, and then what you should do about it. So that's what we're going to do. So as I said, lots of watches. Basically, the way that they all work is they work through measuring movement. If you remember, all of the watches are basically there for logging steps or activity or exercise of some kind, measuring the kilocalories or the kilojoules that you're using. So that was the original function of all of these watches. And then it became clear that we could use the same data. If we added in the pulse rate, we could use that data to actually tell us something about your sleep patterns. So they all use movement, and then they all have a little light at the back, which is measuring pulse rate and it's measuring oxygen. Now, if you look at what outputs you get from your watch, they may not all have oxygen there, and you may need to switch it on as a separate extra or pay for the oxygen to be on. But that's what it's kind of measuring. It's looking at the little red blood cells, looking at the pulse rate and looking at the little red blood cells and seeing what percentage of them are filled with oxygen. So that's what it's measuring, and then it uses a whole bunch of gimmicks to figure out what the sleep stages are from that. So we're not talking about activity at all. We're really just talking about sleep today. Now, I'm sure many of you have been into hospital and you've had a little plastic thing put on your finger over your fingernail, and they've said to you that that's going to measure your oxygen level. So if you have an anesthetic, you'll have either a probe on your finger or something on your finger that measures your oxygen level. And the reason why is because we use your fingernail because it's see-through. So it's the place in the body where we can directly see the little blood vessels in your skin, underneath that skin layer, and we can see the blood there. And there's a different, if your little blood cells have oxygen in them, they reflect the light differently to if they don't have oxygen on them. And so again, a whole lot of magical stuff happens, and the output will come. Your oxygen level is 90, there's a 95% saturation. Okay. That's obviously very good. The lower the saturation gets, the worse it is. Now, before COVID, nobody knew anything about oxygen saturation. And during COVID, everyone was obsessed about oxygen saturation because it was that measure that gave us an indication whether you needed to go on oxygen or not and whether you had to be admitted to hospital. That was the big measure, because as your oxygen level drops, it means that your lungs are not coping and are not able to get enough oxygen into the system. So everyone knows about oxygen saturation. And it's really important when we talk about sleep apnea to understand that the drops that happen in sleep apnea are completely different to the drops that happen in the situations such as COVID, emphysema, long-term asthma, kind of restrictive lung disease, pulmonary embolus. So everything that's happening in the lungs is going to have this drop in the baseline oxygen, whereas apneas is a very quick up and down happening. So apneas, if you remember from a previous podcast, it's where the throat closes for about 10 seconds, 15 seconds, and then the throat opens again. And during that 10 seconds, the oxygen is going to drop down. And as soon as you wake up, it goes back up to normal. And that's really important when it comes to how useful are these devices in picking up sleep apnea. And we'll talk about that a little bit later. But that's what they're measuring. So the best place you can measure it is on the fingernail. It's transparent. You can see right in, you can get some good data about the oxygen. But you can measure it through the skin, and that's what the watches do. They measure it through the skin. Now, there's some dispute about, is it different if you have thick skin in that area? Is it different if your skin is darker as opposed to lighter? Because the dark skin tends to reflect sunlight, and does it reflect enough of the light from the watch to actually make a difference to the values? And what about tattoos, where you have very, very dark skin? Does that make a difference? And we're not sure whether there's a significant difference in all of those, and whether the error that's created by that actually makes a difference. So we're not sure, but you may find that if you do have tattoos on one arm and you don't on another, that you get different readings on the two arms. So that might make a difference. So they're measuring movement, they're measuring heart rate, and then from the heart rate, they then look at heart rate variability. And heart rate variability really is a measure of how much does your heart rate vary, beat by beat. So they'll look at, say, 5 beats of the heart. How much variability was there in there? Was one shorter and one longer and one quicker and one faster? And so high heart rate variability means that the heart rate is varying quite a lot. Okay. Don't ask me what quite a lot means. That's what they say. It's varying quite a lot. There's a definition for high heart rate variability. It's difficult to figure out in these watches like what that actually means. But that's what heart rate variability means. And by using the oxygen level, heart rate variability, and movement, you can figure out if people are awake or asleep. So obviously, if you're awake, then your heart rate variability is high. You're doing things, you're moving. Every time you move, your heart rate goes up. If you sit still for a while, your heart rate goes down. And so your heart rate variability is high and your movement is high. And so when that movement stops and the heart rate variability starts to slow down so it's more stable, that's when the device will tell you you've probably fallen asleep in that situation. Okay. Then when we look at sleep, there are different stages. So it's relatively easy for a device to tell you when you fall asleep and when you wake up. And that will give you duration of sleep. So that's fairly easy to do. What has come through in the last couple of years is now taking that sleep, that solid block of sleep, and telling you whether it's light sleep, deep sleep, or REM sleep, or awake. So those are the 4 kind of stages that they generally look at. And it's a matter of looking at those two things, the movement and the heart rate variability, and looking at the different combinations of that and what kind of sleep that would be. So light sleep would be when you go from being awake, so high heart rate variability and lots of movement, and the movement slows down and the heart rate variability slows down, then they would go, that is light sleep. Deep sleep is where both of those get much less. So there's virtually no movement in deep sleep, and the heart rate variability is very low. So if the heart rate is very stable, then they would call that deep sleep. Okay, so that would be deep sleep. Then if you move into REM sleep, or rapid eye movement sleep, which is also a kind of deep sleep, but we call it REM sleep. If you move into REM sleep, then you have no movement whatsoever, because one of the nice things about REM sleep is that your body is paralyzed. And why that's nice is because it means your brain can think whatever it likes, have whatever conversations with whoever it likes, have whatever dreams it likes, and there are no consequences. So normally you can have this massive big dream, you're going down a river, whitewater rafting, blah, 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 but you are still lying in bed and nothing is happening. So you're paralyzed during REM sleep, and so that paralysis means there is absolutely no movement. So when they find absolutely no movement, that's a suggestion that you've gone into REM sleep, but the heart rate variability goes up. And that is because the control of your heart as to be very stable during REM sleep is not as good as it should be. And so the heart rate variability can be fairly high, but the movement is low. So you can see there are these combinations. If there's lots of movement and high heart rate variability, that'll be awake. As the movement goes down and as the variability goes down, they'll probably call that light sleep. If it goes even lower, they'll probably call that deep sleep. And then if with no movement, if the heart rate variability goes up, they will probably call that REM sleep. So that's how the sleep stages are worked out. Okay. Obviously, there's a whole lot of analysis that's happening behind the scenes to figure that out. Now, how accurate are they? So I would say that 3 times a week, at least, I have patients coming in and saying, I know they're not very accurate, but, well, they're not bad, and they're actually getting better. But we need to be careful that we don't get obsessed about the numbers that these devices are producing. So let's look at some numbers that are created by these devices and where inaccuracy might come in and where you need to be careful. So the most accurate the devices are going to be is if you have a pattern of sleep where you go to bed at, say, 10:30, you go brush your teeth, put on your PJs, get into bed, and you're asleep at 11, and then you sleep till 6, and you're up by 6:10. That is where they're going to be the most accurate, because it's very easy to detect wakefulness, because you're up and you're moving. Where things can get a bit tricky is if you go to bed at 8, lie still in bed watching movies for 3 hours, and then go to sleep, you might find that the accuracy then is not good. Because generally, if you're quiet, it'll assume that you're sleeping. The most bizarre one I've ever had was a patient who was put on a lot of medication, way too much medication. And during the day, she was just sitting in a chair watching TV, hardly ever moved. Her husband contacted me because he was really concerned about her. And she sat for long periods in the day, and she sent me her Garmin recording, and it said that she was asleep for 15 hours a day. She was saying she was only sleeping for 2 hours. The Garmin said 15 hours, and that because she just sat quiet. She was very quiet. She didn't move because she was so drugged. And so you can get very bizarre recordings if that kind of thing happens. So if you spend a lot of time being still during the day, you might find that it actually miscalculates the amount of sleep. So if you have good sleep hygiene and what we call good sleep efficiency, and sleep efficiency is the time that you sleep over the time you spend in bed, and that should be about 90%. So you should have 15 minutes to half an hour at the beginning and a quarter of an hour at the end. And if you do that, it's likely to be more accurate. So the first thing that these devices measure is they measure duration of sleep. If you have the sleep efficiency and if you're a normal sleeper, they're likely to be accurate. If you have insomnia and you spend a lot of time lying in bed trying to fall asleep, they're going to be less accurate at actually measuring the sleep. So patients will say to me, I hardly slept a wink, but my Garmin said I slept for 4 hours. And I'm saying, well, because you're lying in bed trying to fall asleep and you're lying super still because you're trying to fall asleep. At some point, the Garmin goes, you must have fallen asleep, right? They cannot look in your brain. They cannot see that your brain is still awake. They're literally measuring movement and this heart rate variability. So if you have insomnia, likely to be less accurate on duration, particularly if you spend a lot of time lying in bed trying to fall asleep. So the first thing is duration. What is normal duration? There isn't a normal. The average is 7 to 8 hours. That is, if you take 10,000 people, ask them how long they slept, the average is 7 to 8 hours. But there are people who only need 5 hours of sleep, and that's their normal duration, and other people who need 9 hours of sleep. Normal amount of sleep is the amount of sleep that you get, that you know the next day you're going to be able to function without feeling tired. That's normal sleep, and it's different for different people. So that's duration of sleep. We would say that an hour, if you lose an hour of sleep, you're going to feel it the next day. There's going to be some dysfunction, and usually after lunch. So in that natural dip that everybody has. So the dip you should have after lunch should simply be a dip of, I don't think I should do any constructive right now, to actually frankly falling asleep. And the less sleep you have at night, the more likely you are to feel as though you're going to frankly fall asleep after lunch. So that's duration. Okay, so that's the first measurement that's going to come out. And then you're going to get the different sleep stages. You're going to get deep sleep, light sleep, and REM sleep. Now, I don't want to say that light sleep is useless and we don't really care about light sleep. We do, but we care about it in context with REM and deep sleep. So the really easy sum to remember is that REM sleep should be 20% of your night, and deep sleep should be 20% of your night, of your sleep. Right? Not of the time you spend in bed, of your sleep. So the more accurate you can make your sleep, you don't spend lots of time lying in bed, the more accurate you can make your sleep, the more accurate the REM sleep and the deep sleep are going to be. So 20%. Now, that's a bit of a moving target, and there is an error in the system. So when we look at the data, the error in calculating deep sleep on the different devices can range from 10 minutes on an Oura Ring to 45 minutes on one of the watches. So there can be quite a bit of error, but 45 minutes is not a train smash. It's really not. So please don't go and buy a better watch and a better watch and a better watch, because you want to be more and more accurate. Remember that these numbers are simply a guide for you to use. I do have patients who come in and say, so my deep sleep is only at 15%. How can I get it higher? And I go, you can't actually, right? It might be fine. How are you during the day? I'm fine during the day, but there's this 4%. And I go, calm down. You don't use those numbers and push the numbers. If you are sleeping well, then you're sleeping well. And that's the bigger thing. So it's really important to use the watches carefully and not get obsessed about the numbers. I have patients who go, I've switched the watch off because I cannot deal with all those numbers anymore. I start getting obsessed with them. So deep sleep 20%, REM sleep 20%. If it's sitting at 15%, that's probably okay. So we would go 15 to 20%, that's probably in the normal zone. However, if it's sitting at 4% or 5% every night, that's a problem. That shouldn't be like that. Then try to see if maybe you need to move the watch onto the other arm. Maybe maybe that will make a difference, especially if you have a tattoo on one arm. So look at whether there might be a reason why that particular arm is a problem. But generally, if you're getting 4%, 5%, up to 10%. So use 10% as your line. If you're getting below 10%, that is usually a problem. If you're getting between 10 and 15% and you're waking up exhausted and you're tired all day, that is a problem, even if it's 10 to 15%. So those are some rough guides to use when you're looking at those stages of sleep to go, are they abnormal or not? So the reason why REM sleep might be abnormal, right, that might be reduced, is because you woke up too early. REM sleep is in the second half of the night mainly, and if you wake up too early, you might have cut off a whole piece of REM sleep that was going to happen. So that's the simple reason. Deep sleep happens towards the beginning of the night, and so your deep sleep is usually never, a low percentage of deep sleep is usually never because you woke up too early. That's usually not what it is. But most of the big sleep disorders are going to specifically reduce deep sleep. So those are sleep apnea, restless legs, periodic limb movements, those kind of disorders. Your deep sleep is going to be gone. And the deep sleep is what makes you wake up in the morning feeling physically restored. I had a good sleep. I'm well rested. It's that's going to, that's the impact you're going to feel in the morning. REM sleep is more about brain restoration. And so it might be more involved in memory and concentration function during the day. Like that may be more where the REM sleep is involved. But in sleep apnea, for example, we find that deep sleep goes quite quickly and REM sleep stays. So you often get normal REM sleep, but very low deep sleep in people who have very bad apnea. And REM sleep only starts to go in patients who have extremely bad apnea. So when we're looking at 90 apneas an hour, desaturations all over the place, then that's where the REM sleep is going to go. So a consistently low deep sleep, a consistently low REM sleep may mean there's an issue. But please don't go to your doctor and tell them, my deep sleep is low, what do I do? Okay. Do some work beforehand. And the work that you can do beforehand is the two big disorders, restless legs. Look up the questions on restless legs. We've done a whole podcast on restless legs. Do you have restless legs? Are you a restless sleeper? Have people said that you kick during the night? You may have leg movements. Do you snore? Has anyone said that you stop breathing? Do you wake up feeling exhausted? Do you have any symptoms of sleep apnea? Then go to your doctor and say, I think I might have sleep apnea. I snore. My wife says I stop breathing and my deep sleep is low on my watch. So that's the way to use that information, is in conjunction with how you feel during the day. Do I have symptoms? Do I wake up tired? Am I sleepy during the day? Am I falling asleep in every Teams meeting? Do you have symptoms? And then looking at this drop in deep sleep or REM sleep that you might have. And it really is important that you look at it over time. One night of low deep sleep is not important. 30 nights of consistently deep sleep, that's important, because it may mean that you're not getting the kind of sleep that you need. And then it comes in this issue of how is it always a bad thing? And the problem is, it probably is. And the problem with sleep apnea and leg movements is that you get used to how you feel in the morning and you don't realize how tired you actually are. And often people will say, I'm tired, it's work stress, it's the kids, it's something, and you'll find an excuse as to why you're tired in the morning. And it may not be that, it may be because of a sleep problem. So I have patients with apnea often, and I say, how do you feel in the morning when you wake up? Are you tired? And they go, no, I feel okay. But then I feel tired during the day. And when we treat the apnea, particularly with CPAP, because we can obliterate the apnea completely, they wake up and they go, oh, no. I feel much better now. So I wasn't feeling great, but I just got used to how I was feeling. So a low deep sleep, a consistently low deep sleep, even if you feel like you're okay during the day, may indicate that you have a sleep disorder still. So that's what we would do. If your duration is very low, consistently low, 4-5 hours, you may have insomnia. If your deep sleep or your REM sleep, i.e. what we call the internal structure of sleep, has been changed, then that may indicate one of these diseases that you'd never know you have unless somebody tells you you have it. Now, some of the watches, as I mentioned, also pick up oxygen saturation. And there's a caveat here. They pick up oxygen saturation, but they usually only sample the oxygen, i.e. pick up the value, every minute or so. And you may notice that if you don't have the oxygen saturation turned on in your watch, the battery lasts for 4 days. But if you switch on the oxygen saturation, it only lasts for 2 days. And that is because suddenly it's sampling this a lot more often. But even so, if it samples every minute, it's going to miss most of the apneas because they're 15 seconds long. So it will pick up the normal saturation before the apnea. Then you have an apnea, the oxygen drops, but then you wake up after 15 seconds, the saturation goes back to normal, and then it has another ping. So it only picks up the normal saturation. Every so often, it'll pick up an abnormal one, but it's certainly not the total number that are there. So if you do have the oxygen saturation switched on, and you're monitoring the oxygen, and you get a lot of numbers in the 80s, 83, 85, 81, they look like they're scattered all over the place, that may imply that you do have sleep apnea. But then you combine that information with the deep sleep and do I snore? Has anyone said, have I stopped breathing? And you go, oh, that combo, that may mean I have sleep apnea. So it's not a diagnostic test for apnea at all. The iWatch is getting better at looking at apneas. So it's not diagnostic at all, but what it does is it gives us some information, because otherwise sleep is this mysterious black hole. We go to sleep, we wake up the next morning, we have no idea what's happened. And all of this information from the watches gives us a starting point at which we can say, here's what's happening when I sleep at night. What's happening also with the iWatch particularly is that it's able to pick up abnormal heartbeats and to say, and again, it's not diagnostic, again say to you, it looks like your heartbeat is abnormal. And that means there's an abnormal rhythm. Instead of going doof, 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 it's going doof, 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 doof. It's doing that kind of thing. And that's abnormal. And so it can pick that up because it's looking at the variability. So it can also pick that up. Again, not diagnostic, but if your watch is telling you that your heartbeat is abnormal, please go tell your doctor that. He will do an ECG and they'll find out that's the gold standard. Doing a full ECG, is there an abnormal heartbeat? So that's also useful to know. So the watches can be used for many things, and they're coming out with more and more things that they are measuring. So for example, the Garmin watch will tell you about restless moments. Doesn't really tell you what is normal restless moments and what is abnormal restless moments. But if you look at the sleep staging, you'll see lots of little pink things happening during the night. And again, it's looking at that and going, I do wake up feeling tired and I have like 50 restless moments during the night. Maybe those two are connected. And they go to somebody and say, listen, I'm feeling tired when I wake up in the morning. My Garmin tells me I have lots of restless moments. Could that be sleep apnea? Yeah, it could. Could that be leg movements? Yeah, it could. All of that is possible, and then further testing will be able to tell us exactly what is causing those restless moments. So body battery works on the same kind of thing. It works on how long you've slept for and how much deep sleep you have, and that will tell you what the body battery is. You should, if you go to sleep at night with a body battery of 45, you should wake up in the morning with a body battery over 75. There should be a restorative thing that's happening during the night. But if you go to bed with a body battery of 50 and you wake up with a body battery of 55, that's a problem. It may indicate that you have a sleep disorder. So all of these are indications that something is not right with your sleep. You're not having this deep, restful sleep. And it may explain why you feel tired during the day, why you feel sleepy when you try to read, why you fall asleep, 5 minutes into every movie. It may explain that, and so it's worthwhile checking it out. So I hope this was useful. I find that a lot of patients have got this information and don't understand what is normal and abnormal. I hope this has clarified that for you, and that you can now look at the information coming from your wearables with more insight and understand at which point you would take that information to your doctor and go, I think there's something really wrong here. Thank you very much for listening. Thanks again to Restonic for sponsoring the podcast. This is Dr. Alison Bentley from the Sleep Health Center, and I hope you have a good sleep.
You've been listening to another production from Solid Gold Podcasts.